Good morning. Today is August 20th, which means it is Southern HIV/AIDS Awareness Day. My name is Dafina Ward, and I have the honor of serving as the Executive Director of the Southern AIDS Coalition. And I am joined this morning by Mr. Harold Phillips, Director of the White House Office of National AIDS Policy. Good morning, Harold.
Good morning, Dafina. Good morning, everyone.
Thank you so much for taking the time to have this conversation with us this morning on our third annual SHAD. And you've been a friend of SHAD since the beginning. So we appreciate that. You were at our first event in Birmingham, Alabama, which is where I am today. We were able to gather more than 200 folks from across the South and from across the nation who wanted to have these conversations about the importance of the South. And yet we cannot go outside and be together in person like we want right now. I'm glad we can still connect virtually. So why don't we start by telling us why SHAD is important to you?
SHAD is important to me because it helps elevate and lift up those conversations about what's unique about the South and the Southern response to the HIV epidemic. You know, when we talk about the issues of systemic and structural issues that get in the way of both HIV prevention and care and treatment, the South is at the heart of that. So as we talk about racism and discrimination and stigma, all of those pieces are all part and parcel of the work that needs to happen as we sort of look at those systems and figure out how to make them work differently for people of color.
Yeah, absolutely. And I mean, I know you are not maybe a Southerner by birth, right? Like you're not a native Southerner, but I know you've spent time here. So, you know, part of SHAD is that we talk about the fact we know there's a lot of problems in the region. We know there's a lot of work to do, but the South is a beautiful place and there's a lot of assets and strength here too. So what is your sweetest memory of being in the South?
Hold on, Dafina. Okay. Somebody is at my door and I want to answer that question.
All right. Go right ahead. For everybody who's here, you know how it is when we are on virtual platforms, anything can happen. I want to encourage you to please, if you have questions or thoughts, please share those and we will have some Q&A towards the end of the conversation. We really appreciate you all being with us. If you have not already, please share this live video. Please tag us when you do and use the hashtags. We really want to thank everyone who has really taken on to SHAD and taken ownership of it. Southern AIDS Coalition is excited to be the catalyst for this awareness day, but it truly belongs to all of us. So thank you to all of the organizations and individuals and advocates who are doing work across the South and are amplifying the Southern HIV epidemic and our strategies for ending it today for SHAD. All right, we all good?
I think we're all good. We're going to try to figure out to reschedule the alarm guy.
Well, look, this is how everybody knows we're live, right?
Like everybody, we are live. But let me answer your question about the South and, you know, my connection to the South. Both my grandparents on my mother's side and also on my father's side, but my mother's side in particular, my grandfather was from Baton Rouge and my grandmother was from Laurel, Mississippi. And they were part of that great migration north back in the 30s and 40s and came up to Chicago for opportunities. And also in my grandfather's case, to get away from potential lynching. And so that's sort of my family history with the South. So, you know, sometimes we call Chicago the Mississippi of the North, and I'm a product of that. And that the roots, the culture, all ended up being part and ingrained in me. And then when I went to school in North Carolina, folks said, you know, they could definitely identify and sort of see things about me that were Southern in my background and in my upbringing and my approach to life that I didn't even realize were there. Yeah. So the South is very special and dear to me. And you know, it's part of my bloodline.
Yeah, absolutely. I mean, I think most folks can trace their roots back to the South, particularly Black folks, right? Yeah. So absolutely. And then you were talking about that and you think about the Great Migration and you think about all of the work around the fight for equality and rights that have happened in the South since. When we talk about ending the Southern HIV epidemic, I think I'm still of the mind of how can we not, and that we definitely will when you think about what we've overcome in this region thus far. Just had the opportunity to share with some of my team members who were in Alabama for the first time. We went to 16th Street Baptist Church, and sharing in that story of what that experience was like and how much we've overcome. And I'm sure there was a time where folks like that felt that would never change. And here we are. So we have to hold to that too, and remember the strength of this region. So you have a big job, and we know you're still new in your role. When you were tasked and tapped to take on this job, director at ONAP, what was your biggest hope and what was your biggest hesitation?
Ooh, great question. So, my biggest hope, we heard President Biden on the campaign trail talk about his commitment to ending the HIV epidemic. We also heard a lot about the issues of racism and equality. And when they contacted me and I had to do the interview for the job, there were a lot of questions about HIV in the United States, and also what President Biden had said on the campaign trail. And one of the interview questions was about how did I see taking what he had said on the campaign trail and making that a reality? So basically working toward an end of the HIV epidemic, the ability to accelerate our efforts, the opportunity to center the HIV response, center equity as part of the HIV response, and a real commitment to deal with racism, stigma, homophobia, and the gender inequality as well. And so my greatest hope was being able to do all that as part of the national HIV/AIDS strategy, but then also figure out, based on my years of being in government, how do I make these government systems work differently for our people? And I feel very supported in that from Susan Rice, who runs the Domestic Policy Council. And she really got it and understood it, and I helped sort of them understand sort of what's different from being at HHS and doing the work, and also the power of the White House. And being able to sort of do that and work to help make the agenda move forward and improve the quality of life for all people at risk and also living with HIV across the nation. So that's my biggest hope for all of this. I think, my biggest fear is that there's a lot of great things I think we're able to do at the federal level, but really some of this is going to have to happen at the state and local level and impact individuals and their families. I think it was somebody Tip O'Neill, a politician from days gone by, who used to say all politics is local. And making some of these changes also have to happen at the local level. So in terms of my hope, I'm going to do everything I can and work with our federal partners and others sort of at the national level. But it's really and I'm hoping to be able to give tools to those of you at the local level to also continue to make these changes that are necessary.
Yeah. It's funny. I appreciate that around the fact that, all politics is local, and so much of what has to happen has to be community led and driven, which means that it has to have the resources to support it. So often our work at SAC, and we're talking to organizations in the South who are doing the work on the ground, they talk about the difficulty of accessing those resources, that it feels like the funding comes into their state and gets to certain organizations, but that those community-led organizations aren't getting an opportunity to build infrastructure of their programs and organizations to really do meaningful and impactful work. And you noted like the power of the White House. How could you use that power and harness that to help get more of those resources to those community-led organizations that are truly on the work, making an impact, on the ground, making an impact?
Sure. So one of the things that has happened really early on in this administration, they've done what we call a request for information from all of the different departments, and OMB has led this effort to really look at how can we and what our departments and programs currently doing to target resources toward communities most in need. And then, so all of that information has come in. They're in the process of analyzing and taking a look at it. And then we're also having conversations at the White House about what else can we do to address the disparity and also get through contracts and grants and cooperative agreements, resources, financial resources to those communities most impacted. The other thing that I would say that also helps is ensuring that community is engaged and at the table. I know during the first year of EHE, we've heard a lot about what worked and what didn't work. And so the federal agencies and HHS are also coming together to figure out what else can be done. And we also want to know what we can do based on what we're hearing and make some improvements there. But it's definitely on the radar, and it's something that we're all looking at and trying to see what else can we do, as well as where are some of the gaps and how we make funds available to those communities.
Mm-hmm. With the listening sessions with EHE, I know some of the feedback, you get a lot of feedback because you listen to the community. I think that's one of the reasons folks were so excited about your appointment, because they see you as part of this community. So some of the feedback with the EHE listening sessions was that folks felt like they talked and they weren't sure if they were heard, or what kind of the accountability might be around making sure that their voices were actually integrated into the planning. So what type of steps are you taking to ensure that MEPA, the meaningful involvement of people with HIV and AIDS, is really a part of every aspect of the work in your office, and how you hold other parts of the government accountable around that?
Yeah, so I think September, we're having a meeting to sort of all come together collectively, because not only have I heard some things, but also, HRSA has had their listening sessions that I think were in a lot of different regions across the country. We want to come together and sort of collectively sort of look at what we've heard and figure out a way forward. And I know also our, I won't say she's new because she's been there now since I think late January, early February, Dr. Levine, the Assistant Secretary for Health, has also been very committed to making changes, because she's also heard from the community. So CDC has heard some of it. Pacha heard some of it in their meeting this month as well. I have heard several community meetings, like you mentioned. And so we want to come together collectively, look at what we heard, and figure out how we make some changes and tweaks based on comments from the community.
Yeah. I'm glad you mentioned Pacha. There were some really exciting appointments made recently. And as a Black woman leading an HIV-focused organization, I was very excited to see so many Black women appointed to Pacha, powerful Black women who I greatly respect. And could you talk a little bit about how you see Pacha evolving, and how their work in collaboration with you may even look different than in years past?
Yeah. So the Pacha, for those who don't know, is the President's AIDS Council on HIV. The President's Council on HIV/AIDS is the acronym, and that body, which is made up of researchers and healthcare providers and community members, all sort of focusing and making recommendations to the White House and to HHS and others about sort of the national HIV response. Pacha, before the pandemic hit, Pacha was doing a series of being out in the community and really sort of taking the meetings out of Washington. And they did two of those. One of them was in Jackson, Mississippi. I didn't get to attend that one, but the other one was in Miami, and getting a sense of the epidemic, being able to talk to the providers. And then we had to sort of shut that down as COVID went on. But one of the things that we were hoping would come out of that, and how we're sort of moving Pacha in a different direction, is not only can they make recommendations, but they can also, in addition to those recommendations, really work to instruct us to explore different issues that are impacting the community. They can raise concerns. There's also public comment that goes into Pacha. So there's lots of different tools at their disposal that can help inform the work of the White House as well as our national HIV response. So one of the things that they're doing, and right now with me not having staff, Pacha really is stepping forward and helping us, but with the national HIV strategy. One of the things that they're going to be doing, I think, as part of the strategy development, is really helping me and our office and the team from OIDP that's working with me on the strategy to ensure that we have strategies and objectives that really target the private and commercial sector. It's something we haven't done in our previous strategy, but as we've talked about, we need all of the federal government involved to help us in the HIV epidemic. We also need our private and commercial partners. There are things that they can do and that they do better than government that can really be helpful in this effort. And so Pacha's working with our office and HHS to really sort of figure out and make sure that there's space in the strategy for them. And then we're thinking about trying whether or not we can put together a virtual or in person sort of White House convening to really ensure that, the big private partners understand that we're working to end the HIV epidemic, and so they can sort of see their part in it as well.
Mm-hmm. I'm so glad you added that last part, because that was going to be my next question. How do we ensure that we bring in private partners who clearly have a financial stake, right, in HIV around medication and other things, that
That's
folks
right.
are coming to the table with integrity. And it sounds like that's already a part of what your thinking and planning includes, because that's a big concern often from the community as well. I'd like to talk about the South for a little bit. So,
Okay.
we know when you look at the EHE jurisdictions, most of those are Southern communities, when we're talking about ending the epidemic and where we're seeing the greatest rates of HIV and the greatest need. How do you hope your office will be able to demonstrate the commitment to the South that's reflected in the EHE as you're working to update the National HIV Strategic Plan? What are your thoughts on specifically honing in on focusing and being committed to the South as a region?
So, very many of the EHE jurisdictions are located in the Southern United States.
Mm-hmm.
And in thinking about sort of the support for EHE, it's both increasing funding to those jurisdictions so we can ensure that they have those resources. Two is the work that needs to happen when it comes to community engagement and making sure that there are representatives of those Southern communities that are at the table, that they are engaged, and that they are listened to. I think the other piece of working with the South is from the White House. And I have a meeting on this today, really beginning to think about how do we engage the Southern government leaders around this effort. When we talk about equity and we talk about improving population health, there are partners and partnerships that we need to create across the board. Sometimes it might be around environmental justice. Sometimes it's social justice issues that align with our public health goals. And I think getting government leaders to understand that is going to be really key as well. And so thinking about sort of the White House, thinking about ending the HIV epidemic, which is an administration priority, and how do we move that forward? Like we talked about politics being local, really and truly engaging those local political leaders to get them on board and understand as we bring communities together so that they can work in partnership with them. And so that's another part of the commitment I think I have to the South, because I think there's some unique aspects there that we really and truly need to hone in on and work collaboratively with those leaders who are innovative and forward thinking.
Yeah, absolutely. I think, as a Southerner, my whole life, And sitting in this work, there is obviously a weariness for folks who are in the South in this fight, because it sounds wonderful, the idea of, engaging government leaders here. And we also see what's happening in our local governments and in our state houses, and the attacks through legislation and all types of activities that indirectly or directly impact people living with HIV, communities most impacted by HIV. How do we reconcile that? How do we come to a space of being able to address what we need in order to end this epidemic, when it seems that we're really dealing with adversarial spaces in most southern states?
Yeah, I think we're always going to have adversaries. I think that you mentioned how far we've come in the South, and how far we've come as a nation. And sometimes it does feel like we take 2 steps forward and then 1 step back. But I think right now there is this sort of collective energy that is where individuals are coming together, and at the same time, our nation is changing. Even the demographics of the South are changing. Before things sort of shut down, I did sort of a swing through Atlanta, and I was amazed at how the Latinx and Hispanic culture has just grown in Atlanta in the last 10 years. I think I had not been there in maybe 5 years, and just sort of seeing that and understanding that the demographics and the culture are changing, which also means that the programs and the systems also need to change. Mm-hmm. So I think, there are, and I think some of the increase in volume that we're hearing from others who are resistant to that change is a result of that. And I don't want to sort of diminish, but the clock is ticking. And I think we're going to continue to march toward that change. And we're not going to stop.
Yeah.
Can't. We can't stop. Mm-hmm. We started talking about sort of Southern roots and ancestry. There was a point last year, I think, like many Black Americans, where you just had to stop and reflect. There was so much that was coming at us, that it seemed often overwhelming. But there was also a realization of just how far we've come. And I had to sort of sit in that space a bit. Things are not as bad as when my mother and father were coming up, or my grandparents, who I talked about, sort of left the South and came to Chicago for a different set of opportunities, or their parents. So 3 or 4 generations back, thinking about the fact that I've gone beyond, and many of us on this call have gone beyond what our great-grandparents and great-great-grandparents ever thought or dreamed was possible. Mm-hmm. And sort of sitting in that space where I think about the work that still needs to be done, and just thinking about, I'm not talking about too many generations back in terms of what we've achieved and what we've accomplished now. And that doesn't mean that there's not still work to be done, but sort of sitting in that space of being grateful and humble, but still ready to roll up the sleeves and continue to do the work that needs to be done.
Yeah. What is your heart space in this work? Like, when you think about, you have both a personal and professional journey. When we talk about ending this epidemic and making sure the folks living with HIV have everything they need to thrive. When you get exhausted and tired and weary, even though we know we have to keep going, like what recenters you? What is it that you bring, to your heart to remind you that you can't do that and keep fighting?
And I've said this also to some of my other federal colleagues, and what recenters me is being out in the community, or hearing from the community. And not only hearing about the stuff that's not working, but there are those moments where I have had the opportunity to see what it's like when the system works for somebody. When I'm talking to somebody who used to use substances and was in and out of homelessness, and they got access to HIV care, and then were able to sort of turn their life around, and get reunited with their children and their families, and they've been living with HIV for 10, 15 years. That's when I sort of see this is the way it's supposed to work.
Yeah.
And we need to make it work that way for everyone. When I hear from a young Black gay man that they were able to access and get on PrEP with their provider, and they now don't have fear when it comes to loving or having sex, or they feel like they used to feel like getting HIV it was destined that they were going to become HIV positive, but now they've gotten access to PrEP and they don't have that fear anymore. That's when I realized, yeah, this is the way it's supposed to work. Yeah. And how do we scale that up? And how do we make sure that everyone has that access or everyone has that story? Yeah. I talk about once I was on a site visit in the Virgin Islands, and there was a woman, and I never will forget her face, but it seemed like in every meeting, she was looking at me and smiling and smiling and smiling. And I was like, why is she looking at me like that? Is it my suit? And by the end of the day, she walked up to me and she said, you're part of that HRSA team that was able to approve the carryover request so we could have more money for dental services. And these are my new teeth. And she said, and because I have these new teeth, I can eat, and I'm gaining weight, and me and my doctors are happy.
Yeah.
And it was, and for me, sitting in Washington and just kind of like on paper approving, saying yes, approved, and moving it, I didn't realize it was going to mean that much. But she was so proud of those new teeth, and she was so happy. And it just reminded me of, at the end of the day, this is about people's lives. And that if we can make these systems work like they should, we will improve people's lives and the quality of life.
Yeah, there's so much in what you just said. So the first thing I would ask as a follow-up to that is, one thing that's notable in all the examples you provide is that there had to be someone that a person encountered, a provider who understood their need, was responsive to that need, and provided them access to the services that really had nothing to do with the person's HIV status, right? Right. There were other needs in place that were identified. How do we, particularly in the South, create more spaces from where you sit, create more opportunities for the sharing of best practices, as Deasia said in the comments, for peer learning and accountability, that's the type of experience that every person has when they walk into a space for services and support?
I think we can do it in a lot of different ways, and that's another reason why I love you all and what you do. It is about sort of sharing those best practices, those ideas, technical assistance, and sort of that peer learning that can go on across the southern states, and creating those opportunities for that. I think the other thing that we're trying to do on the federal level is trying to, and many organizations have, I know HRSA and CDC and NIH have pulled together innovative and best practices that are available on their websites that individuals can use. The other thing I think that's happening that is exciting is the work that's happening with the AIDS education and training centers to help train providers across the country and also regionally in the South, to really and truly get them to understand, not stigmatize, not traumatize individuals, and provide patient-centered care. I think the other space where we need to do some more of this is working with our professional medical associations and getting them to understand some of these issues, and being able to sort of operate in that space. So we're definitely trying to make sure that they're on board and that they understand. And I'll give you a great example. I heard a story the other day of, and this again was a young gay Black man who talked to his provider and said, I would like to go on PrEP. And the provider said, oh, you don't need to go on PrEP. You're not having that much sex. You're not out there like that. And, right there, it sort of shut down a conversation. Here's someone coming with a need. And so really working, I think, with our professional medical associations to get them to understand that oath you took about not doing any harm, and sort of the ways, sometimes intentional, sometimes not intentional, that you can do harm.
Mm-hmm. Absolutely. We have a great question from Alfonso, which Alfonso, you read my mind because I was going here next. So change is good and change is hard. We see in a lot of organizations that there's a need change, and organizations just holding on how they've been doing things for 20 or 30 years. How do we encourage that change? We talked some about the accountability of making sure the community-led efforts are a part of that. But how else do you think we encourage organizations that change is good and to engage in that and to inspire people who are living with HIV to speak out and have hope in those agencies that serve them that don't always feel like they're for them?
Right. I think good question, because I think that, one of the things that I'm committed to continuing to do is use this platform to push and encourage change. I had a conversation with some folks from the CDC just the other day about ending the HIV epidemic. And what they said to me is that we need to optimize our efforts to reach high risk populations and ensure that they have access to testing, comprehensive prevention, linkage to care. They can get and maintain viral suppression, which means making sure that they have the wraparound services that sometimes get in the way of viral suppression and staying in treatment. And so they said, if we do that, and especially in the EHE jurisdictions, so again, sort of focusing on the South, then we can end the epidemic. And so that means we've got to push for change. We can't keep doing things the same way. And we can't keep doing things in the same populations the same way. And so even understanding what needs to change, we need the voices of individuals with lived experience at the table. And we need to respond and act based on what we hear from those voices. So we're going to continue to push that both at the White House and among our federal partners as well, to try to get that and figure out different ways to support that change, both through the financing and opportunities to share the best practices. One of the things about sort of conferences and meetings is that opportunity to hear and learn about best practices. So I'm hoping that everybody gets vaccinated. We continue to wear our masks so that in 2022, we can all be together. But I think a lot of organizations like you all have done a great job of sharing within those, within the virtual spaces as well.
Absolutely. And I appreciate that, Reggie. Absolutely. Active duty and military veterans definitely need to be at that table. And we start talking about the communities that are most impacted. Have talked to a number of groups that still feel like that they're not seen and included in those conversations. And so it is important to make sure our table is big enough and there's space for everybody. What you noted from that meeting that you were in and that conversation with CDC, that takes a whole lot of coordination, all those things that need to happen. And when we layer on the challenges that are particular to the South, you're talking about transportation issues and the lack of public transportation, a lack of healthcare providers in many communities, lack of Medicaid expansion and access to primary healthcare, racist, systemic racism, challenges with our justice system. And there's just so many layers to that. So I'd love to hear from you. There have been some really great examples of partnerships that have addressed intersections of HIV and other things, namely the Violence Against Women's Act and funding that address the needs of folks who may be dealing with, a lack of stable housing stemming from intimate partner violence. So what other types of thoughts do you have around how we can work, across the federal government to address some of those issues that are extremely severe here in the South that impact HIV, but may not be directly related to HIV?
Yeah. So we're using the development of this new national HIV/AIDS strategy to bring some of those other departments and programs together at the table. So, within HUD, we've got the HOPWA program, Housing Opportunities for People with AIDS. And it's a great program, but it serves only those living with HIV. So thinking about those at risk. So since we reopened White House Office of National AIDS Policy, we've had a meeting with other HUD officials, also Department of Labor as well, to think about sort of the employment issues. And so and the Department of Agriculture has participated in a recent meeting to really talk about and understand the issues of food insecurity and how they play a role in this, and how we need those programs at the table and working with us in a lot of different ways, either partnership, helping with enrollment, raising awareness of the needs to serve people living with HIV. And so some ideas are starting to get generated about how we can work together across the federal space in some of those programs. We're also seeking to sit down and talk with the Social Security Administration, as well as the Department of Education, and think about how do we make safe spaces that also include access to HIV education and school health programs that have access to PrEP for our youth as well. So a lot of sort of trying to bring people together. And some of this, and some of it, I feel like my job is trying to get individuals to understand that HIV isn't what it was 40 years ago, and also understand sort of the intersect of these issues and how we're working in the same communities and share similar goals, helping individuals live their best lives possible. And that includes health and some of the other aspects where those programs have a very specific mission.
Mm-hmm. Since we're talking about change, I think we have a comment from Mark that speaks to this. How do we ensure that when folks living with HIV are at the table, that they're actually heard? Because we talk a lot in this work about how we have to stay away from tokenizing folks, bringing them into these spaces because they check different demographics boxes. And many times we hear from people living with HIV in these spaces who don't feel heard. What would it look like for there to be resources to allow folks living with HIV to even build their own tables and tell us what it looks like and what those needs are? And is that something that you think on as you think about what kind of change and transformation we need?
Yeah, I think that Mark asked a really important question, and I have always advocated in my federal career that when we bring the community to the table and have these listening sessions, we also have a responsibility to come back and tell the community what we're going to do with what we heard. And sometimes that might mean I can't do anything with what I heard, or I can do some of this, but I can't do all of it. And I'm really pushing our federal partners to try to adopt that philosophy as well. And I think part of the meeting that we want to have in September with the federal agencies is just that, to figure out what have we all heard, what are the things that are actionable, and then how do we inform the community about what we're doing with the information that we heard. I know very often it's frustrating to come to these listening sessions. You talk to folks, you tell them what's needed, and then you don't hear anything or you don't see anything. I think the other thing, and why it's important that our federal partners have that dialogue, is that often government doesn't move fast. And so it's important that we let the community know we heard you and we're working on it, and here's what we're doing. We can often do that faster than we can actually sort of change some of the systems. So I'm encouraging that, and I expect that as we get closer to World AIDS Day, I want us to be able to talk about what changes we're making based on what we heard when it comes to community engagement.
Yeah, absolutely. I appreciate this idea of making sure the community understands how things work or what the expectations should be, right?
Right.
One of the core tenets of of effective community engagement is being upfront about what expectations should be. When you're inviting people to the table, let them know if it's a decision-making space or not, or if it's just an information gathering space. And so often I just don't think that we always do a good job of making that clear, which leads to a lot of frustration and tension.
And I would also say, if I could, I would also say that the community should also feel free to go back to those leaders and say, okay, we told you 6 months ago, a year ago, we had a listening session and we told you X, Y, and Z. What happened? What did you do? Mm-hmm. We want to report back. I think, there's a joint level of accountability that needs to happen in some of these spaces. And I have often felt that if we don't do that, then the community is going to get tired of coming to the table. Yeah. Like,
for what?
What?
Yeah. That also, I think, Harold, speaks to the importance, this idea of making sure that people understand what the expectations should be. Also speaks to the necessity of really an intergenerational approach too, because we're talking about being 40 years into this epidemic, and there is a new generation of leadership that is, that needs to be developed and supported and mentored. What role do you see yourself and others who have been doing this work for quite some time? What role do you see in actually developing that pipeline of leadership? And when necessary, kind of getting out of the way and letting other voices be heard in this space.
Yeah, it's really important, and it is something that we've begun to talk about and think about. How do we do that and develop sort of that next generation of leaders to be able to sort of operate in this space? And so I've been talking to some of the community groups, as well as talking to some of the federal partners about, are there ways that we can provide, and I've also been talking to some of the HBCUs about this as well. Are there ways that we can look at providing paid internships for people of color to work in some of these government spaces so that they get that opportunity to both network, learn the policies, the procedures, and understand how things work so that they are able to make that change? I have frequently said to some young people, if you learn how to successfully write grants, you'll never be broke, and you'll never be without a way to help make the change you want to happen. And it's true. And so I have sometimes encouraged folks to not only write grants, but see if you can work with HRSA and CDC and get on their grant review committees so you can understand what goes into that process, how it all is shaped, what are sort of different reviewers looking at when they look at proposals. Yeah. You can also see what not to do or what not to put into proposals, and the importance of sort of following those guidelines. It's a great learning opportunity, and they often pay in the federal government for you to review those grants. So it's a paid learning opportunity as well that then you can take and use for yourself. But we are looking at ways that we might be able to do more of this, because I'm 55, and at some point I need to be able to hand the reins off to someone else. I have said it's part of my goal to make sure that I am not the last Black gay HIV positive director of the White House Office of National AIDS Policy.
Absolutely. We're talking about this kind of from a macro, sitting at federal tables, kind kind of way. But here in the region, when we're talking to people who are advocates in their own communities, engaged with, state health departments and in other spaces, we want people on these planning councils, get on committees of these boards of these, community-based organizations, and be voices in that way. And so often I think what happens is that when people challenge the status quo, they feel like they get blackballed and don't have an opportunity to continue to be a part of the work. So what do we say to them when you're the troublemaker in the space? Because things need to be different, particularly for those who are here in the South and dealing with a lot of systemic challenges on top of that. What do we say to encourage them?
I think, and I'm a big fan of John Lewis, and I'm a big fan of good trouble.
Absolutely.
And I think that, when you're going to make good trouble and you're going to be that troublemaker, you need to make sure that there are others at your back. It's hard and difficult to be the troublemaker and be out there in front without backup. And that backup might come from your community. It might come from your state. It might come from other feds. There have been times I know in my career where I've had to swoop in and support troublemakers who were, definitely ruffling feathers, but the feathers needed to be ruffled. We needed change. And sort of folks were hearing it from the local folks, but having federal support come in and be able to say, no, they're right. These are the things that need to change in this community really helped. So if you are a troublemaker, make sure you're making trouble and that you have a posse at the ready. And that posse might be local, it might be state, but it might be also federal. And it might also be peers from other places.
Yeah.
To be able to, as Alfonso says, if you want to go fast, go alone. If you want to go far, go together.
That's it.
And it's so true. And I think, like you were talking about, sort of having peers from other places who can come in and talk about what's happening in other places and support your move for change too is also really important.
Yeah. And that's what we want to do, at Southern AIDS Coalition. We want to create spaces and seek to create spaces for folks to learn from one another and realize they're not alone, because we know in a lot of communities, you might be the only one, but the internet works, phones work, and we'll have your back, even if it's from a distance. So thank you.
You're welcome.
For that.
I'm going to add one other thing to that too. Sometimes there's a tendency to sort of silo ourselves. So there's folks who will make trouble when it comes to women's issues. There are folks that will make trouble when it comes to MSM issues. There are folks that will make trouble when it comes to transgender issues. If we sat down together sometimes and talked about the intersect of those issues, we can make trouble together, because sometimes some of the issues that plague our individual communities are really and truly collective problems and issues. And we could sometimes get farther working together. And I think part of that is also the listening and learning. I'm not ashamed sometimes, and I don't feel, but I also to talk about the issues of Black women, because I've sat and I've listened and learned from them, but also making space for them at the table. And also when they're not at the table, making sure that I represent. The same thing is happening now when it comes to transgender women and those issues, and thinking about sort of gender-based violence and income inequality. We all got to stand up for each other. And in these spaces, when we see that our brothers and sisters are not at the table, we need to make space for them at the table, but we also need to make sure that room is held accountable, that this is not just an MSM issue. Mm-hmm. This happens to our sisters. Mm-hmm. And at the next meeting, I'm bringing them. I'm coming with them.
That's right.
And so I think as we build this unity and this coalition and we push for change, making sure that where we have intersecting issues, that there are a diversity of voices at the table, and very often we can get on the same page about some of these pieces, some of these issues.
Absolutely. We have to remember that when we talk about injustice, the system was created to keep those who were most oppressed separate, keep
That's
us
right.
infighting so that we don't do this work together. But if there's a same gender loving man who's being discriminated against, I need to speak up in that. And I would expect him to do the same for me, because we have to do that for one another. And we've been tricked into thinking we can only
That's
care
right.
about one issue at a time.
That's right. And when we talk about structures and systems, and the historical structures and systems that were created to divide us and keep us divided on the plantations so that we could not organize or think or talk or write together.
That's right.
And things that need to be dismantled so that we can come together and unify around our common causes and address the oppression.
Yeah. Yeah. We have to. You know,
Right.
this is what has to happen for true change to happen. And we won't end the epidemic in the South if we don't do just that. If we
That's
don't
right.
address everyone's need. And that's those are the conversations that we have to have. I'm gonna ask you a couple more things, because I know we're coming to an end. If you have questions, folks who are watching, thanks for being so engaged. Please throw those in the chat so we can get those answered, because we have to get off in a few minutes. I want to speak, we're talking about intersections. I want to speak specifically to the needs of Latinx communities in the South, and folks being in fear of even accessing services, or just not having access or resources, often in rural communities as a result of immigration status and insurance status and all of that. How do we do better? I'd love to hear your perspective from where you sit at ONAP, but I know even as an organization in the South, language justice and engagement of all communities is something we're working to do better at Southern AIDS Coalition. But I would love to hear your thoughts on, from where you sit, how do we make it better, and how do we better engage those communities?
I think a couple of things, and thinking about some of the themes that we've already talked about today. I think one of the challenges with organizing in the Latinx and Hispanic community is that it's a multinational and multi-ethnic community.
Mm-hmm.
And so it's important for all of us, but also important for them. And I think it will be helpful for their community if there are trusted community voices that can step forward and do some of this work.
Yeah.
And because they come from different cultural, political, national backgrounds, that it is often difficult to try to organize them. Because here in this country, we think of them as one big group. There's Honduras, there's Panama, there's El Salvador, there's Mexico, there's Brazil. I mean, it goes on and on and on. And so how do we bring them together? I think, one, we need trusted voices of that community. We need to also ensure that there's space at the table for them. The issue of language equity is important, but also, like I'm saying, they're multicultural. So cultural equity is also important in those discussions, and understanding sort of which groups are sort of your majority groups that you may want to work with in your particular region of the South, or your area or city, and ensuring that they're there. The other thing that I think, one of the things that I have been told and am learning is that rather than looking at HIV as a public health issue and sort of that concept of public health, which may not be as cultural for them, there is the issue of social justice. And if you can approach the HIV work from sort of a social justice lens, you may also get more involvement from their communities at the table. And so I think it is both being able to have that dialogue, and also what I think is also exciting is that as these communities grow in our country, they are forming sort of community cultural institutions. May not be as old as ours in the African American community, but they are beginning and burgeoning. And so therefore, I think it's a good time to be able to engage with them and talk about some of these issues, and figure out different ways that we can work together.
Yeah. And we need to fund them. They need,
Yes.
getting rid of the barriers. So many of our traditional funding structures really are just a hindrance, just create all types of barriers for organizations where you have those folks who are of the community that are trusted and resources and can get the folks together, and they may be monolingual Spanish speaking, and they maybe don't have that grant writing experience, or they have so much other expertise. And so how we build more structures to provide the technical assistance that's culturally responsive and just get them what they need to do the work. So systemically getting out of the way to help organizations do just that. I mean, there's so much we haven't touched on, and I feel like we need to do a part 2 if you'll agree to that. But
yeah,
because, okay, let's talk. Yep. We've got to touch on COVID. We know the significant impact that COVID has had on our workforce in HIV, on accessing testing and services. What are you thinking? Because we don't know what the long term. I mean, we have a sense. We know, particularly in the South, testing, was down. I think in the state of Georgia, they reported 70% decrease in testing between spring 2019, spring 2020. Commercial lab testing was down by almost half in some places. So, what do we do? What are your thoughts on how we move forward from here, since we don't know what the long term impacts of COVID will be on this?
Yeah. I thank you for that question, because it's really important and something we've been talking about a lot since we saw this most recent report about the sort of reduction in Georgia. The story of COVID-19 is not over, and its impact on our effort to end the HIV epidemic is a story that's not yet completely written. I think we need to use what came out of that report and that study for Georgia as a warning bell. And we need to double down on our efforts. It's going to be up to us as stakeholders in all of this to decide whether COVID-19 is a bump in the road on our way to ending the HIV epidemic, or is it that the whole bridge collapsed and we couldn't get there? So while this story is not over, we need to accelerate, as President Biden has said, accelerate the efforts. That's why he put requested 670 million for EHE. Second, CDC is talking about optimizing our response, using new technologies, telehealth, self-testing to make it happen. And then many of our community health centers and other providers are coming back online or are already online and making HIV treatment available and still doing business as usual. And we need to get the word out that has not stopped, and we've got to move faster. So I think while the study from Georgia, and there are a couple of others that have come out in the last couple of week or two, while they are important, we need to act like they are sort of the wake-up call for all of us to really get busy and accelerate this effort, and not let it be the story that we couldn't get there because of COVID.
Absolutely. If anything, it should be a rallying cry for us to push even harder and get more folks engaged in this work. And shout out to mutual aid and local folks who have just done the work to care for our communities. These organizations we've been talking about that are community led, and these have just kept folks afloat and loved on them through all of this. So there's so much we can learn from the way the community has responded in the wake of COVID. And you mentioned, the telemedicine, the home testing, all these things where we saw an uptake in different methods of folks engaging in care. How do we make sure we keep those? How do we make sure we have the money in the coffers and the resources to keep that going after COVID?
Yeah, the federal partners are definitely looking at all of that. And we're sort of looking at some of the flexibilities that were made during the public health emergency for telehealth. How do we make some of those permanent, and also evaluate their impacts? CDC and the work around self-testing and continuing to make funds available. That work will continue as well. So everybody's already thinking about that. And you're right. It's been incredible to see what the community has done in order to continue to care for those at risk and living with HIV. And we have to not let COVID stop us.
Yeah. Yeah, we can't. We can't let COVID stop us because the work has to continue. I keep saying my last question. This is really my last question. So, we know that there have been some new developments around the accessibility of PrEP. And so would love to hear, from you, how do we ensure unfettered access to PrEP, particularly in Southern communities and rural communities where you may not have maybe even access to a practicing physician or folks engaged in care where they might be able to even receive the prescription and the support and the services to even gain PrEP if that's something they desire. So just want to hear what kind of advice or thoughts you have.
So really excited about the new guidelines that have come out to clarify that PrEP should be covered by insurance companies as well as the lab costs as well, and the cost of HIV testing as a preventive service. So what that does for us is that for those with insurance now have greater access to PrEP, and for those that have been uninsured but have signed up for insurance in the marketplace under Medicaid expansion and the ACA, that also opens up the door for more access to PrEP for those individuals. Currently, for those without, we still have the Ready Set PrEP program by HHS for those who are uninsured. And also there are still patient assistance programs that are in existence that can also help those who don't have insurance and access to PrEP. We're continuing to work in community health centers to also cover PrEP for those who don't have insurance. So going to hiv.gov and seeing using their PrEP locator can help you find a PrEP provider in your community, including those places in the South. So we're continuing to look at that. CDC is also working on revising the PrEP guidelines, which based on the last drafts I saw, I think that some of those changes will also make PrEP easier and more accessible. We also have injectables that are coming on the line, probably sometime early next year in 2022. So it's a really, so I think ways to provide PrEP in more accessible individual and giving individuals more choice about how you take PrEP and what's going to work for you and your lifestyle are all coming up. So great HIV prevention tools, which also has this excitement around let's make sure that we continue to message the availability and find ways to provide access.
Absolutely. And we've put the link for the PrEP locator in the chat for folks. So please go utilize that. Before we close, Harold, do you have any just parting thoughts before we finish up?
So I want to say thank you to SAC for all the work that you do and how you continue to lift up the regional issues and also support the networks within the South. I know that oftentimes this work can be frustrating and sometimes it feels like an uphill battle. But just know that there are those of us who appreciate, understand, and we are pushing to try to make this uphill battle as easier for you. I can't promise that it will ever get completely easy, but with some knowledge and awareness and also figuring out how do we make the levers of government work differently, we hope to make this a little bit easier. And I'm looking forward to continuing to work toward an end of the HIV epidemic and be able to hand all of this over to the next generation.
All right. Thank you so much, Harold. We appreciate you. Thank you for your time today. It means so much to have the support from the federal level. And SAC is only as good as the community that we work with and partner with. And so we truly are a coalition. And all of you are a part of that who are watching, whether you knew that or not. So we're really glad to be able to convene folks in this way. And just kind of speaking of partnership, Southern AIDS Coalition is really committed to hearing Southern voices and to making sure your voices are heard at the federal level. So as Harold mentioned, that there is an update happening to the National HIV Strategic Plan. We want Southern voices to be a part of that. So SAC has volunteered to provide some input from you all. So please visit the link to complete the survey that will just be open for 7 days because this is a quick turnaround because they are working furiously at the White House to get this update completed. And there's also going to be a series of listening sessions next week. You can learn out about all of that and how you can participate on our website and using the link that's been provided here. We can't thank you enough. Again, Harold, thank you for the way that you represent, always show up, and you always take the questions, even when they're hard. And we appreciate that and respect your leadership so much. Congratulations again to the new appointees of Pacha. I have to shout out my special friends, Rania Copeland, Tori Cooper, and Marlene McNeese, and just all the wonderful folks who are representing us at the federal level. We appreciate your efforts so much. And thanks to all of the folks in the states who are doing the work on the ground in the South. And thank you to the brave advocates living with HIV who continue to shine a light on stigma and remind us that the work is in front of us and we cannot stop. So let's commit to keep going together. Today is SHAD, Support, Act, Change. Our next session will be at noon Eastern, 11 Central. It's all about how we sustain emerging Southern leaders and organizations, and it's really good. You don't want to miss it. So I hope to see you back here soon. Thank you so much. Have a great day.
Thank you.
Thanks.